So here we're going to talk about the nursing process and the application to pharmacological needs. So whenever we talk about the pharmacology and we know we have to do the nursing process. In order to do nursing process, we need some important things like we need to do the assessment, and then we need the nursing diagnosis, we need to do the planning, we need to do the implementation, and in the end we need to evaluate. So we need to know that there are 5 important things which we call ADPIE. Also assessment, we have to see diagnosis a patient problem, we have to do the planning, after the planning we have to implement, and at the end we have to evaluate. So now we are going to talk about the very first step, which is assessment. For assessment, assessment, as the word says, we already see the word and we know what it means. Assessment means that we need to assess something. So for the pharmacology need, what we need to assess for the patient, we need to see what is the drug history, what are the allergies, height, weight, age, any hepatic or renal function. Hepatic, we know it relates to the liver, renal relates to the kidney, and we need to know if the patient understands whatever the drugs patient is taking. Number second is subjective and objective. So it's very important that when we assess the patient, we make sure we note the subjective data, which is subjective data means what the patient is telling us. And objective data is the one, the actual facts, and we need to have both of them for our assessment. And then with the assessment, it's also included head to toe. We need to know all the body systems, and then Gordon's functional health system, which I'm going to talk in another video in detail. And then we need to have the data from primary sources. When we do the assessment, the patient can tell us the information, and that is a primary source. And then we can get some information from the secondary sources. For example, family can be a secondary resource, and then tertiary sources through the literature search. So we can do the assessment for the patient is a very first step of ADPIE or the nursing process. After we assess the patient as a nurse, the next step would be the nursing diagnosis. And now the word itself, when we say is nursing diagnosis, it means the nurse is diagnosing, is looking over a problem. So what do we need? So first of all, the number 1 point, the orders. We need the orders required, because in order to perform any action, we as a nurse have to make sure we have healthcare providers order. And then the second point is nursing diagnosis statement, signs and symptoms related to the problem. So we need to identify what the patient problem is. What is the impairment? What is wrong with the patient? What is broken with the patient? So we need to know and see what are the signs and symptoms which are related to the problem. And then for the drug, because we are talking about the pharmacology, so we need to know the drug monograms. So why we are using a drug, whatever its adverse effect, its usage, its dose, we need to know everything about the drug. And then pathophysiology. So as we see how, like pathophysiology, if you see the word, how do you know what that means? So if you break that word, patho we know related to with the disease, and physio is related with the function, and ology is related, it means study. So here, like, we can see the meaning of the word, just breaking the word into different parts. So pathophysiology is when we see the specific, we study about the specific function of the body, and we see what is the disease with that particular organ or a system. And we need to know, this is very important. And also, as we're talking about drugs, so we need to know if the patient is using multiple drugs. We need to see when the one drug interacts with other drugs. So what are the interaction, what it causes, and what is like anything wrong happens with any of the body system due to the use of the drug. So we need to see that. And for example, after the nursing diagnosis, we can make a patient problem statement. For example, dehydration, which is a patient problem, and we have done a diagnosis, and it is related to, RT means related to inadequate fluid intake. So the dehydration is a problem, and how it is for what it is related to. It is related to the inadequate fluid intake. Less fluid was taken by the patient. Now we need to know how we know that. We have made the patient problem. We have make a statement, but then also very important that we know why, how we know that. So we can tell it's evidenced by dry skin and decreased skin turgor. So we can see because the skin is dry, the skin turgor is decreased. What do you mean by skin turgor? What do you mean when you say decreased skin turgor? So when we check the skin of the patient, so for example, I'm checking on the hand. So I'm going to pinch the skin of the hand, and we will see how the skin responds after we pinch the skin. So I'm going to talk about this in detail in another video. Please put in comments if you want the skin turgor in detail. So for now, so skin turgor would be best like when we have to check patient's skin, and we need to check the hydration level, and by pinching of the skin how it bends or make a tan, so we can figure out if the patient is hydrated or patient is dehydrated. So in the nursing diagnosis, we see what the patient problem is. We make a problem statement, and but we should always know that how the problem is related to what parts, and how we need some evidence, we need some proof that how do we know that as a nurse. And then after the nursing diagnosis is the planning. So after we are done with nursing diagnosis, then we are going to do the planning. So the planning phase is as a nurse, we plan what are we gonna do. So as a nurse, we're gonna plan. We will prioritize the problems as more severe to the less severe. So we can follow Maslow's hierarchy in here, and we can see what problems are more severe, and then from the top, then we can go down and listing the problems to like being less severe. So we know what we need to do first. So in many questions also, they always ask, what as a nurse you do first? So Maslow's hierarchy is very important, and it helps in the test taking. It is one of the test taking strategies too, and help us to know what we're gonna do first. And then we can see what are the long and short term goals, and critical pathways or standardized care plans, what we're gonna follow. And for the pharmacology, because we are talking about the nursing process as a pharmacology, and we need to see what are the drug monographs, so all the details about the drug, and we need to make sure we make the individualized teaching plans, and those have the therapeutic outcomes, because we want therapeutic outcomes. We have a goal, so we want the patient to attain the best possible functional level, and for that, so we need to check that. And then we can also follow the SMART, which means specific, measurable, attainable, realistic, and timely. So our goal, we have to be sure that it is a realistic goal, and all these factors we can take into consideration while we are planning. And then we have to make sure we see the drug dosage, scheduling, any adverse effects, when the patient is taking multiple drugs, if there is any side effects with the multiple drugs or with the drug-drug interaction, what is happening with the patient's body, and also the drug-food interaction. So after we plan, then is the next phase, which is implementation. So implementation means that when we talk about the nursing intervention, what are we gonna do? So we assess the patient, we have the diagnosis, we did the planning. Now what? We need to take into the, we have to take the action, we have to do the intervention. So we have to see what was the patient's response to the treatment, and make sure when we are talking about the drugs, we have to be sure we are administrating the prescribed drug using the 7 rights. What are the 7 rights? We have to make sure that it's the right patient, that we are giving the drug with the right route of the administration, the right time, the right dose, any adverse effect, and documentation. So documentation is very important. And then we need to follow the orders, because we can't go without the orders, and we have to follow whatever the orders are. And the nurse can also work with other team members like the pharmacist, and if there is anything the nurse needs to know about the medication or anything, and the nurse can collaborate with the pharmacist, with other team members. And also it's nurse responsibility to select the correct supplies. And as we get the orders, the healthcare provider gives us the order, but as a nurse it's our responsibility to check, to verify all aspects of the order, and also document. And the last phase is evaluation. So in the evaluation, we need to review and analyze. We need to see why we need to do that, because we need to see if the goal is met or not met. And if the goal is not met, what is wrong? So then we can modify the care plan so that our ultimate goal, that is the patient returns to the higher level of functioning, is met. We need to have the patient provide the best care possible for the patient, so we can evaluate if the goal is met, and if not met, what we can do about that. And then the systematic approach we have to see, because we are talking about the nursing process for the pharmacology, so we need to see that if the patient can tolerate the drug, and also what is the patient's response to the drug, because some of the drugs has a really adverse effect on patients. The patient may have any allergies or any issues like that. So we need to make sure after that the patient is all right and okay, and to the drug administration, and if the goal is met, or we can review. So this was all about the nursing process, about the pharmacology. And thank you.